mum's innate concern that her baby is moving significantly less than normal is a trigger and a red flag that needs, investigation. I spend half my time being a clinical obstetrician that, at every visit I would ask a mum how her baby is moving. Is it moving normally for her? Does she have any concerns? Has she had any concerns in the recent past? And I'd also reiterate the message that says, if you do have concerns, we have a telephone number for our triage facility, and we usually highlight that. And so mums know, firstly, that they're having normal movements is good, and they also know what to do if their movements are less. In the UK, we try and give everyone a standardised leaflet at somewhere between 20 and 28 weeks of pregnancy, and the idea is to try and make sure that the information that we're giving out is standardised. And that leaflet, we've got that in lots of different languages, so women whose first language isn't English can still access that information. And that encourages them to kind of say, get to know your baby's pattern. If you're concerned about baby's movements, then contact your maternity provider. We don't use a specific number, but we're comfortable if that helps some people. So, if someone finds that actually counting, or they've got, a wristband and that helps them, just keep abreast of it, then that's, from my point of view, I think that's fine, because it's just helping them to be aware of their baby's movements. We don't say, 10 movements in 12 hours, 10 movements in 2 hours, because each baby is so different, and we know that also there is a degree of change over pregnancy. I think about educating mums, but we also need to educate care providers so that when mums present with reduced movements, they get consistent care. They're not just dismissed or made to feel stupid.
Before Count the Kicks, even within our own practice, we were fairly inconsistent in talking to patients about monitoring their baby's activities. But we knew, just common sense, we knew that active babies were healthy babies. So now, when Count the Kicks came in and we began telling every patient to start counting the kicks at 28 weeks, we felt much more comfortable within our practice that we were doing all that we could to prevent stillbirth. And then at the hospital, where we act as consultants, we saw numerous situations where patients had come in with decreased fetal movement, and we were able to intervene in a timely fashion and save babies. So yes, we've definitely seen it in our practice. We've seen it work.
I think the best data we have at the moment is that, asking mums, making sure they know what to do if their baby's not moving normally, and having a balanced approach when they come to hospital is the way forward. The data suggests that if you pay attention to baby's movements, that the attachment between mum and baby goes up. Like we said before, that anxiety goes down. There's some evidence that it may reduce things like NICU admission, babies born with the lowest sort of scores at birth that tell us how compromised baby is. All of those things go in what we would regard as a positive direction.
I would ask all providers in the obstetric world, whether you're a generalist, OB/GYN provider, whether you're a midwife provider, lay midwife, otherwise, whether you're a high-risk maternal fetal medicine provider like myself, to take advantage of the information that Count the Kicks has available to you to provide your patients and help everyone decrease the incidence of stillbirth, one of the most tragic occurrences that we all have seen and experienced, because it's still happening in too great numbers. It needs to become a rare event. Ruby is a classic example, the story of Ruby. That was at our facility. That was one of the first times that the Count the Kicks app had been used to save a baby, if not the first time, at least that we know about. It's been a very impactful program here in the state of Iowa, and certainly for our practice as well.